So today we are going to discuss nerve fiber classification. To understand nerve fiber classification, first of all we have to understand the conduction velocity of nerve fiber through axons, because most of the classification of nerve fiber is based on conduction velocity, myelination and functions of the nerve. So how the action potential conduct through axons? Okay, that is the conduction of action potential. To understand this topic, I am drawing one axon. So suppose this is a part of the axon I have taken. So this is part of the axons, right? And suppose that this is a myelination. This is a myelinated neuron. So this is the myelination of the neuron, right? So this is myelination. Now, whenever you generate one action potential at the node of this Ranvier, we have seen in the previous classes that action potential means there will be entry of sodium through the voltage gated sodium channel, and huge amount of sodium will enter through this voltage gated sodium channel. Now, after entry of this sodium into the cytoplasm of these axons, what is the fate of this sodium? What is the fate of this sodium? This sodium can move in both the direction through the cytoplasm of this neuron. So suppose the sodium is moving through the cytoplasm towards the other node of Ranvier. It is moving. Sodium is moving through the cytoplasm. Whenever this sodium will reach in the next node of Ranvier, because of positive charge of sodium, it will causes depolarization of the next node of Ranvier. Now, if this depolarization in the next node of Ranvier is adequate enough, so this depolarization, if it is adequate enough, then what it will do? It will open up further voltage gated sodium channel in the next node of Ranvier, right? It is opening up more and more sodium channel in the next node of Ranvier. And if this depolarization, okay, because of the sodium is more than the threshold voltage, more than that of the threshold voltage of the membrane, then what will happen? Almost all the voltage gated sodium channel which are present at the level of next node of Ranvier will open up simultaneously, and due to opening of this huge amount of sodium channel, huge sodium enter in the cells, and that will raise the membrane voltage again up to plus 35 millivolt. That means there will be generation of second action potential in the next node of Ranvier. So what I told so far, I told that if you generate one action potential in one of the node of Ranvier, then the sodium which has entered into the cytoplasm, that sodium will move to the next node. It will causes local depolarization. If that local depolarization is adequate enough, then further voltage gated sodium channel will open up, and that will give rise to another action potential in the next node. This kind of movement of action potential, we say that action potential moves from one node to another node, or you can say that action potential jump from one node to another node. Again, the sodium which has entered in the next node of Ranvier, again it will do the same thing, means it will try to move in the next node of Ranvier. Okay, so suppose this is the myelination. Okay, so the sodium will reach in the next node of Ranvier, and in the next node of Ranvier, again if the depolarization is adequate enough, further voltage gated sodium channel will open up, and that will give rise to another action potential here. So we describe this kind of movement of action potential as jumping of action potential from one node to another node. But this is not actually jumping. This is basically movement of sodium. This is basically movement of sodium through cytoplasm of the axons. And this jumping pattern of action potential, we know that we gives the name of this kind of conduction as saltatory conduction of action potential. Okay, so this jumping pattern of action potential is known as saltatory conduction of action potential, right? Now, whenever the action potential is moving from one node to other node, okay, sodium is moving, and when the sodium is moving, there is always a chances that the sodium may leak out from this cell. So during this journey, the sodium may leak out from this neuron via different channels, right? So if I want to generate a second action potential in the next node of Ranvier, I have to prevent this loss of sodium, or I have to prevent this leaking out of sodium from the cell. So how to prevent this leaking out of sodium? Easy. I can give a insulated covering on the surface of the membrane. And if I give an insulated covering here, then the sodium will not be able to penetrate through this insulated covering, and this insulated covering is nothing but myelination of neuron. So getting my point. So whenever you are giving myelination on the surface of the neuron, what you are doing? You are preventing the loss of sodium. You are preventing the leaking of sodium from the cytoplasm. What is the benefit? Benefit is that more amount of sodium will reach in the next node of Ranvier, and probability is that the second action potential will be originated in the next node. So that way, more the myelination, okay, more will be the conduction velocity of action potential. So I can write down here, conduction velocity of action potential. Conduction velocity of action potential. It depends on few factors. The first factor that we have just understood is myelination. Okay, myelination. More you increase the myelination, more will be the conduction velocity of action potential. Now, whenever you are giving myelination, what you are doing? You are giving an insulated covering. Insulated covering means if I measure the resistance across the cell membrane, look at my word, resistance across the cell membrane. So I am measuring the resistance between this surface and this surface of the membrane. So across the cell membrane, I am trying to measure the resistance. This kind of resistance is known as transmembrane resistance. Transmembrane means through and through membrane, you are measuring the resistance between inner and outer. So in between the membrane is there. So you are measuring the resistance between here and here. This is known as transmembrane resistance. So if you give more and more insulated covering on the surface of the membrane, what will happen to transmembrane resistance? It will obviously increase. So increased myelination means there is increase in transmembrane resistance. Transmembrane resistance. Please note down this thing, important for MCQ. Transmembrane resistance, right? So more the myelination means more is the transmembrane resistance. Now second thing you have to understand that increased myelination means there will be decrease in capacitance of the membrane. Increased myelination is also equal to decrease capacitance of the membranes. Decrease capacitance of membrane, right? Decrease capacitance of membrane. So what is membrane capacitance? This is the pure concept of physics. You know the capacitor, okay? So you know parallel plate capacitor. So this is one plate, this is another plate, and this is known as a parallel plate capacitor. So there will be deposition of positive and negative charge. Membrane also behaves like an capacitor. Membrane also behaves like a capacitor, right? So if there is increase in thickness of this plate, what will happen? If there is increase in thickness of this plate, the capacitance decreases. The capacitance decreases. This is the funda of physics, right? Okay. So whenever there is increased thickness of this plate, what will happen? The capacitance decreases. So whenever you are giving myelination more and more here, okay, whenever you are giving myelination more and more here, what will happen? The capacitance of the membranes decreases. Now you must be thinking that what is the role of this capacitance in action potential conduction velocity? I'll come to that. Before that, okay, look at the second property. So just now we have understood that increased myelination means there will be increase in conduction velocity. Now second thing, you know, the second thing is that, okay, just wipe this out, okay. So second thing, whenever the sodium is moving from one node to other node, right, it is moving through the cytoplasm of the neuron. Now if the resistance of the cytoplasm, so inside this cytoplasm, if this resistance is very high, then the sodium will not be able to move again. So what I have to do? I have to decrease this resistance. This resistance is known as exoplasmic resistance. So if I decrease this resistance more and more, then the sodium conduction will be more and more easier, and the conduction velocity of action potential will also be easier. So my conclusion is that I have to decrease this resistance. Which resistance I am talking about? Exoplasmic resistance, not the transmembrane resistance that we have discussed earlier, not the transmembrane resistance. This is the exoplasmic resistance inside the exoplasm. How to decrease this exoplasmic resistance? Very simple. If you increase the diameter of this neuron, more thicker the neuron, lesser will be the exoplasmic resistance. So whenever you are increasing the diameter of the neuron, there will be decrease in exoplasmic resistance. So again, the second factor of increased conduction velocity of action potential is that number 2 is increase in diameter of the neuron. What will happen if you increase the diameter? There will be decrease in exoplasmic resistance of the neuron. Exoplasmic resistance will decrease, right? So this exoplasmic resistance, suppose I am giving this as R. Exoplasmic resistance is denoted by R, and capacitance that we have discussed earlier, suppose I am denoting this capacitance by C. The formula for conduction velocity of action potential through a nerve fiber is inversely proportional to R multiplied by C. That is the exoplasmic resistance and capacitance, the product of these two, capacitance and exoplasmic resistance. So the conduction velocity of action potential on a neuronal membrane is inversely proportionate to RC, the product of RC, that is the resistance and capacitance of the membrane. So whenever you are decreasing the capacitance of the membrane, again there will be increase in conduction velocity, and whenever you are decreasing the exoplasmic resistance of the membrane, again there will be increase in conduction velocity of neuron. Although you remember that whenever you increase the diameter of the axons, capacitance of the membrane also increases a little bit. Don't get confused. Capacitance of the membrane also get increased a little bit. So you can understand like this, that increased diameter means you are decreasing the resistance, that is the R, and you are also increasing the capacitance. But if you look at the product of RC, whenever you are increasing the diameter, if you look at the RC product, it will decrease, because this decrease in exoplasmic resistance, okay, is more than increase in capacitance whenever you increase the same amount of diameter. That's why please remember all this property of increased conduction velocity. So what is the net result? Net understanding is that increased myelination, increased diameter. These are the two main factors that I have to remember. Increased myelination means increase in transmembrane resistance, and increased diameter means decrease in exoplasmic resistance. Apart from that, we also have to remember the concept of capacitance. Okay, membrane behave like a parallel plate capacitor, and conduction velocity is inverse of RC. That's all about the conduction velocity of action potential. Now, depending on this conduction velocity and depending on this diameter and some functional property, there is a classification of the nerve fiber in our body, and this classification which you are seeing on your board, okay, this classification was first time done by two scientists, and they are Erlanger and Grasser. They gives the classification of this nerve fiber as A type of fiber, B type of fiber, and C type of fiber. So all the nerve fiber of our body has been classified into three, A, B, and C. Now this A fiber is again subdivided into A alpha, A beta, A gamma, and A delta. Right? B has no subdivision, C also has no subdivision. Now this A fiber and B fiber, they are myelinated fiber. So A fiber and B fiber, they are myelinated fiber, and C fiber is unmyelinated fiber. This is very, very important. Just now we have understood that if the fiber is myelinated fiber, so conduction velocity will be more. Similarly, A and B fiber will have higher conduction velocity than that of the C fiber, because that is an unmyelinated fiber, right? Now, Whenever this classification was proposed by Erlanger and Glasser, later on, another two scientists, Lloyd and Hunt, they propose another classification. The scientists are very egoistic people. Okay, if you propose some classification, some other group will also propose some classification, and problem is ours, the students. Okay, they have to remember both the classification. So that way, if you look at the Lloyd and Hunt classification, what they did basically nothing. Rather than ABC, they put some number in the classification system. So they told that A alpha type of fiber will be known as 1A and 1B. A beta type of fiber will be known as type 2 fiber. Great. Okay. A delta type of fiber will be known as type 3 fiber, and C fiber will be known as type 4 fiber. In between, type B, they are not including in their classification. A gamma also not there in their classification. Getting my point? So now you have to remember both of these things. Sometimes we will give you that A fiber, B fiber, C fiber, and sometimes we will say type 1A fiber, type 1B fiber. But anyway, they are basically same. A alpha is basically 1A and 1B type of fiber. Okay. A beta is basically type 2 fiber, A delta is type 3 fiber, and C fiber is type 4 fiber. So this is two parallel classification. Now the most important thing is that we have to remember what is the function, means where these kind of fibers are located. If I ask you A alpha fiber, where they are located, your answer will be that all the proprioceptive fiber in our body and all the motor, somatic motor fiber in our body, they are the A alpha fiber. Very, very important, I am telling you. So proprioception, that position of the joint sense. If I ask you that close your eyes and you are holding your arm like this, and if I ask you bring the other arm in the same position, you can easily bring it, right? By understanding the position of this joint, that whether this joint is in flexed or in extended position, this can easily understood by some receptor. Okay, and that is known as the proprioceptor. So proprioceptor is a joint position sense. So proprioceptive fiber and the somatic motor fiber, all the motor neuron, they are A alpha type of fiber. Then A beta type of fiber, as you can find out here, A beta type of fiber, all the touch and pressure fiber, they are the A beta type of fiber. A gamma fiber, if you look at here, A gamma, very, very important, special type of fiber. It is efferent to muscle spindle. Whenever we will discuss the muscle spindle in the central nervous system, okay, you will understand this connection. The A gamma fiber is the efferent to muscle spindle, right? And A delta, again, are very, very important. That is for pain and temperature. Pain and temperature. Temperature means which temperature? Cold temperature. So please note down, this A delta fiber is for pain and temperature. And similarly, if you look at the C fiber, look at the C fiber first. C fiber is also for pain and temperature, but here the temperature is warm temperature, warm temperature. Now, I can just understand that pain is carried by this A delta fiber also, and it is carried by the C fiber also. Right, but A delta fiber, it is a kind of myelinated fiber, and C fiber is an unmyelinated fiber. So obviously the pain which is carried by this A delta fiber, the conduction velocity will be higher. So that's why the pain which is carried by this A delta fiber, this is known as fast pain, right? Fast pain. And the pain which is carried by the C fiber, this is known as the slow pain. The difference between this fast and slow pain will be discussed in detail in central nervous system chapter. Right, so for the time being, you remember the fiber difference. Now in between, if you look at this B fiber, the B fiber is the autonomic fiber, that is the preganglionic autonomic fiber is the B fiber, and the postganglionic autonomic fiber, mainly the sympathetic, is the C fiber. Getting my point? So B fiber is the preganglionic autonomic fiber and C fiber is the postganglionic autonomic fiber. So you have to remember this classification as much as possible, because multiple questions has been given from this classification system. So try to remember this classification as much as possible, whatever I am saying. So just you don't forget that this fast pain is carried by A delta fiber and the slope n is carried by C fiber. Similarly, temperature, cold temperature is A delta and warm temperature is by C fiber. Now the next column here is the conduction velocity of the nerve fiber. Am I going to remember all of this conduction velocity? Answer, you may not. But at least remember that whenever you are moving from A fiber towards the C fiber, okay, because you are moving from myelinated towards unmyelinated, okay, and the diameter of the fiber is also decreasing from A towards C, the conduction velocity will also decrease. Means the fastest conducting nerve fiber in our body is the A alpha variety of fiber. A alpha variety of fiber has a conduction velocity of 70 to 120 meter per seconds. Mind my dear, right? 70 to 120 meter per seconds. Which fiber? Proprioceptive fiber and motor neuron fiber, right? You know, proprioception, they are important for our maintenance of body balance and posture. That's why the conduction velocity is so huge that immediately the posture, whenever it is disturbed, it will be corrected with fractions of second. And that's why the 70 to 120 meter is a conduction velocity of proprioceptive fiber and motor neuron. Similarly, if you look at the touch and pressure fiber, the conduction velocity is 30 to 70 and then 15 to 30, then 12 to 30. So you can find out this is a fast pen 12 to 30 meter per second and the slow pen 0.5 to 2 meter per second. The conduction velocity is hugely different between these two. And the preganglionic sympathetic fiber, parasympathetic fiber has a conduction velocity of this, and postganglionic fiber has a conduction velocity which is lower, right? Now the next column is the diameter. Now the diameter of the nerve fiber, you don't have to remember, because if you divide this conduction velocity with 6, number 6, what I'm saying, look at the number, what is this number, look at this number, so 30. So if I divide this 30, that is the conduction velocity with 6, that is 5, and if I divide this 70 with 6, okay, so that is around 12, okay, approximately 12. So 5 to 12 micrometer will be the diameter of this nerve fiber. So just divide this number, okay, that is 70, divide this 70 with 6, that is 12, and divide this 120 with 6, that is 20. That is the diameter of this nerve fiber. This is just for remembering the information. Otherwise, there is no formula. There is no such formula that conduction velocity upon 6 is diameter. No. This is just for quick remembrance, right? So, if you divide all this number with 6, then you are going to get the diameter of this nerve fiber. For type C fiber, the diameter is almost same to same. Means diameter is 0.5 to 2 micrometer. Okay, so for type C fiber, I am not dividing with 6. Whatever is the diameter, whatever is the conduction velocity, same is the diameter, okay, of this C fiber. Otherwise, in case of A fiber and in case of B fiber, just divide the number with 6, you are going to get the conduction velocity of nerve fiber, right? So this classification, Erlanger and Grasser classification, as well as Lloyd and Hunt classification, is very, very important for your MCQ. Now, from this nerve fiber, there are many other important MCQ. What are those other important MCQ? Note down. So, cold sensation we have seen earlier is carried by A delta fiber, and warm sensation is carried by C fiber we have seen earlier. But apart from that, burning pain, freezing pain, if this is the question in your MCQ, okay, so this is very, very important to remember. Then we all know the very, very controversial question, which fiber is most susceptible to local anesthesia, right? So if you give local anesthesia, it will block different types of nerve fiber by blocking the voltage gated sodium channel. I hope all of you know that local anesthesia, they block this voltage gated sodium channel which are present on this neuron. So what will happen? Action potential will not generate and the pain sensation will also be stopped because the neuron is not generating action potential. So how the pain will be carried out, right? But the question is, which nerve fiber is most susceptible to local anesthesia? Here it is written that A gamma is the most sensitive, followed by A delta, followed by A alpha, A beta, followed by B, and followed by C. Now, if you look at physiology book, particularly the Genong is saying the most susceptible fiber is the C fiber, followed by B fiber, followed by A fiber, means just the opposite sequence of this. right? And if you look at the pharmacology book, again a different sequence is given, that is a B fiber greater than C fiber greater than A fiber. But whatever I have written here, this is I have taken from anesthesia book, Miller's anesthesia and Lee anesthesia. Both of these anesthesia books, they are clearly saying that most susceptible fiber to local anesthesia is A gamma followed by A delta, A gamma followed by A delta followed by A alpha beta followed by B followed by C. If you don't believe, I can show you the table from this Miller's anesthesia. So this is the table from the Miller's anesthesia. As you can find out, the same nerve fiber classification that we have discussed: A fiber, B fiber, C fiber, and here A alpha, A beta, A gamma, A delta. If you look at the susceptibility to local anesthesia column here, susceptibility to local anesthesia, you will be finding out here it is the maximum susceptibility, that is the A gamma fiber. Okay, then you can find out here 3 plus, that is the A delta fiber. Okay, and then you can find out here the A alpha beta, and then here the B fiber, and least is the C fiber. So that way I am saying that if you look at the anesthesia book, particularly the Miller's anesthesia and Lee's anesthesia, A gamma, A delta, A alpha beta followed by B followed by C. Please remember this, because the for MCQ purpose, it is better to follow these anesthesia books. Why I am saying, because this whatever is written in genome, it is based on in vitro experiment, okay, and based on different local anesthesia, particularly the cocaine local anesthesia, right? So that way, whenever you are answering in MCQ, okay, probably the question has been taken from anesthesia book, because in anesthesia book it is clearly mentioned that whenever you give local anesthesia in vivo, it is the A gamma fiber which will be most sensitive, right? So that way, follow this sequence, right? And ultimately it is your decision, but if you ask me, I will say follow this anesthesia one, right? Now, in response to pressure, which nerve fiber is most susceptible? A alpha followed by beta followed by B followed by C. For pressure, it is A followed by B followed by C, and for hypoxia, it is B followed by A followed by C, right? So please note down all these 3 points, that which fiber is most susceptible to local anesthesia, for pressure and for hypoxia. Now, whenever we are understanding that which fiber is most susceptible to pressure, okay, we have to understand another thing that is known as the paresthesia. You know that if you compress nerve fiber, so your nerve fiber is under pressure, all the nerve fiber will be affected, but which nerve fiber will be affected earlier? A fiber, because they have the largest diameter. Now, suppose you are sleeping whole night with your hand just below your head. Okay, so there will be compression of the nerve fiber here, and in the morning you will feel a kind of numbness on this hand. Sometimes you may feel a little bit pain and needling kind of sensation. This kind of numbness and pain needling kind of sensation, that is known as the paresthesia. That is inappropriate sensation such as burning, pricking, okay, numbness. This kind of sensation is known as paresthesia. So paresthesia means the fiber which is going to be affected, the A delta fiber is going to be affected. Okay, so basically it is A fiber which is affecting, but it is giving some kind of burning, it is giving some kind of pricking, it is giving some kind of pain sensation. And which large fiber, which A fiber is responsible for pain? That is the A delta fiber. That's why remember, paresthesia is due to A delta fiber involvement. Similar to paresthesia, there is similar term, another one, and that is known as the palästhesia. Palästhesia. This is related to vibration sense. So, whenever you are not able to feel the vibration sense, that is known as the palästhesia. Vibration is detected by Pacinian corpuscles. We will be discussing in central nervous system. So, vibration sense loss, that is palästhesia, is mostly due to problem of Pacinian corpuscles. Right. Now, in between here, there is another thing, that is spike duration. Could you recall what is spike potential? So, if you recall your action potential diagram like this, I told you in this diagram that the part of the action potential which is above this threshold voltage, this portion, the part of the action potential which is above the threshold voltage, this part is known as spike potential. So if you measure the duration of this spike potential, that is known as spike duration. Okay, if the fiber is a slow conducting fiber, so I can understand that the action potential will also be slow like this. And if the nerve fiber is a faster conducting fiber, then the action potential will look like this. So obviously, the spike duration will be maximum in which fiber? The spike duration will be maximum in C fiber, that is approximately 2 millisecond. Spike duration in case of B fiber, that is 1.2 millisecond, and spike duration in case of A fiber, that is 0.4 to 0.5 millisecond. So this spike duration is also important because this has already been asked in MCQ. So try to remember this. So this is all about your nerve fiber classification that you have to remember for MCQ. Next topic is that if you record the action potential from a nerve fiber, just now I have discussed nerve fiber. Now suppose I want to record the action potential from the surface of a nerve fiber. Maybe this nerve, I want to record the action potential from the surface of this nerve. Okay, the name of that action potential is known as compound action potential. Compound action potential. So this action potential is different from the action potential that we have discussed earlier, because what I am doing here, I am recording the action potential from the surface of a nerve fiber. And which kind of nerve fiber? Mixed nerve fiber. Okay, so mixed nerve fiber. So mixed nerve fiber means I can assume that it will contain different types of nerve fiber. Suppose this is an A alpha type of nerve fiber. It will also contain A beta. So suppose this is an A beta type of nerve fiber, right? It may also contain B fiber, just for understanding purpose only. Suppose this is B fiber, and I will draw another C fiber also. Suppose this is C type of nerve fiber or neuron. So this is known as a mixed nerve. So on this mixed nerve, if I give a stimulation here, so this is the point of stimulation, right? And I am recording the action potential from the surface of this neuron. So this is my recording electrode. Okay, so what I am doing, I am recording the compound action potential from a mixed nerve fiber. So as you can find out here, both the electrodes are placed on the surface of the nerve fiber. Why I am saying this? Because you have to differentiate from this action potential to the other action potential that we have discussed. The action potential that we have already discussed, that is recorded from a single neuron. So this is a single neuron. If I introduce one electrode inside this neuron, this is the position of one electrode inside the cell, and another electrode on the surface of this cell, then if I record the action potential in this fashion, okay, we have seen that the action potential look like this. We have discussed this action potential in the previous chapter. This kind of action potential is known as monophasic action potential. So basically the action potential that we have already discussed, that is a monophasic action potential, and recorded from where? Recorded from a single neuron. And how it is recorded? You have to introduce one electrode inside the cell and one electrode on the surface. Now you compare the monophasic action potential with compound. Here both the recording electrodes are placed on the surface, and surface of where? Surface of mixed nerve, right? So now if you give a stimulation here, this nerve fiber will be activated. Suppose the A fiber, B fiber, they are activated, and C fiber also activated. So they will conduct the action potential. Towards the recording electrode. Now during the conduction of this action potential towards the recording electrode, you know the conduction velocity of different nerve fiber. So the action potential which is carried by this A alpha fiber, it is a huge high conduction velocity. So what will happen? You will get an action potential like this, okay, which is carried by this A alpha fiber. Then B fiber is also carrying the action potential, but the conduction velocity is slower than A alpha fiber. A beta fiber is also carrying. So what will happen? The action potential will reach in the recording electrode a little later and it will look like this, right? Then the B fiber, okay? Now the B fiber is also conducting the action potential. Again, it is slower than A beta fiber also. So the action potential will appear a little later. Similarly, if the C fiber is also conducting the action potential, it will appear at the last like this. So I can understand all this action potential will merge up with one another. So this is one, this is another, okay, this is another. So all this action potential, they will merge up with one another and you are going to get action potential like this. You are going to get action potential like this. What you are getting? You are getting an action potential with multiple peak. You are getting an action potential with multiple peak and this is a biphasic action potential. A major portion of the action potential will also go below the membrane voltage. That's why this is known as a biphasic action potential. Biphasic action potential. Second, this is multiple peak of action potential will be there. So multiple peaks of action potential are also there. And third thing is very, very important. Third thing is it does not follow. It does not follow all or none law. Getting my point? All or none law. So now you compare this property of the compound action potential with a monophasic action potential. Okay, monophasic action potential. Okay, so the first point is different. Second, monophasic action potential contain only one peak, but here I am getting multiple peak, and this multiple peak is due to activation of the multiple fiber. We understood that point, right? And the next thing is that this compound action potential, it does not follow all or none law. Why all or none law it is not following? Because here, if you give a higher strength of stimulation, suppose I am giving a higher strength of stimulation and more number of A alpha fiber is activated. What I am saying, suppose initially there were 50 A alpha fiber was activated. Inside a mix now there will be thousands of different types of fiber, thousands of A alpha fiber, thousands of A beta fiber. So suppose initially when the stimulation was less, 50 A alpha fiber was activated, and now you have increased your strength of stimulation, so 100 A alpha fiber will be activating, right? If more number of A alpha fiber is activated, so what I am going to get here, I am going to get more number of voltage because now simultaneously 100 nerve fiber are active. So what will happen? This amplitude of the action potential will be increased. But previously I told you that all or none law means the amplitude of the action potential is fixed, that is not going to change. So that way this compound action potential is not following all or none law, because whenever you are giving higher strength of stimulation, the amplitude of this action potential will also be higher because more number of fiber will be activated. So this is all about your compound action potential. You have to remember, right? So this is compound action potential. Now, whenever we are discussing compound action potential, you have to remember another property, that is the stimulus parameter. So you are discussing that if you give stimulation on the surface of the neuron. So now we are going to discuss the stimulus properties. So stimulus parameters. What is the meaning of this? This is a separate topic. Okay. So whenever you are giving some stimulation, okay, question is how much voltage you are giving. So that is the amplitude of the stimulus. Okay. And then the second question, that you are giving the stimulation for how much duration. That is the duration of the stimulus. So two parameters. One is the amplitude of the stimulus. So I am drawing this diagram. Look at. Okay. So this is y-axis. This y-axis is denoting the amplitude of this stimulus, and then this is the x-axis. This is the duration of this stimulus. So amplitude and duration, these two are the main parameter of the stimulation. Suppose you have a stimulation machines. With the help of these machines, you are delivering some stimulation to a neuron or stimulation to a tissue. What is the parameter that you are interested? The parameter one is amplitude of this voltage or amplitude of this stimulus and the duration of this stimulus. And the third one is that at what interval you are giving this kind of stimulation. At what interval you are giving this stimulation. That means this interval between these two stimulus, this will determine the frequency of the stimulation, right? So amplitude, duration and frequency. Now depending on this amplitude, frequency and duration, we have to understand three terms, very important terms. Number one, what is the meaning of Rho base? Okay. Second, what is the meaning of utilization time? Utilization time. And third one is, what is the meaning of chronoaxia? Okay. Telling you, these topics are very important for Central Institute examination, particularly INI type of examination. Although it can also be given in NEET, but mainly this is for Central Institute examination. Now, Rho base. Basically, Rho base is nothing but the threshold voltage. So, Rho base is nothing but the threshold voltage. So, what do you mean by threshold voltage? Suppose I have given you one tissue, maybe neuron, maybe skeletal muscle I have given, and I told you please generate one action potential on this tissue by giving some stimulation. Okay, so you have a tissue, maybe neuron, maybe skeletal muscle, and you are giving stimulation. Suppose you are giving a stimulation, okay, with 1 millivolt stimulus strength. So 1 millivolt is the strength of the stimulus, and you are getting no action potential, right? Okay, so what I'm going to do, I'm going to increase the strength of this stimulation 2 millivolt. Again I'm getting no action potential. Now suppose whenever I'm giving a 3 millivolt stimulus, I'm getting an action potential for the first time, right, on the tissue, maybe neuron, maybe skeletal muscle. Now obviously if I give 4 millivolt or if I give 5 millivolt, obviously I'm going to get action potential, right? So the minimum strength of stimulus voltage which is capable of producing an action potential, this is known as the Rho base voltage. Getting my point? So minimum strength of stimulus voltage which is capable of producing an action potential on our tissue, that is known as Rho base voltage or threshold voltage. So basically, Rho base is a term which is specially used for classical physiology. Nowadays we say that this is a threshold voltage for the tissue. So this 4 millivolt or 5 millivolt, they will be known as the supra threshold stimulus for the tissue. Getting my point? Supra threshold stimulus for the tissue. So basically, Rho base means it is the minimum strength of stimulus voltage, minimum strength of stimulus voltage which produces an action potential, right? That is known as Rho base. Now second thing is that utilization time. Okay, so whenever I am defining Rho base, I am not talking about the time duration of the stimulus, only the voltage. What is the minimum voltage? I am least interested about time. Now suppose I am giving this 3 millivolt stimulus to the tissue, so the voltage is equal to the Rho base voltage. Now you are giving 3 millivolt for 1 millisecond duration, and you are getting no action potential on the same tissue. Okay, again you are giving the same Rho base voltage for 2 millisecond duration, again you are getting no action potential on the same tissue. Now if you are giving 3 millivolt Rho base voltage for 2.5 millisecond duration, suddenly you are getting an action potential. So now look at this duration. This is the minimum duration which is required for a Rho base voltage to produce one action potential. This minimum duration is known as utilization time. This is known as utilization time. So utilization time means it is nothing but the duration, time of the stimulus, duration of the stimulus. Minimum duration of Rieu's voltage which is required for production of an action potential. So definition of the utilization time is minimum duration of Rieu's voltage to produce an action potential is known as utilization time. Getting my point? Now, third is the Chronaxy. Okay. Now, I am doubling the Rieu's voltage. Okay. So, Rieu's voltage was 3 millivolt in this example. So, I am doubling that. So, 6 millivolts. So, suppose I am giving 6 millivolt stimulus for 1 millisecond duration on the same tissue, but I am not getting action potential yet. Again, I am giving same, that is the double the Rieu's voltage for 2 milliseconds, and suddenly I am getting an action potential. Obviously, if you increase the stimulus amplitude, the duration will be lesser. So that's why you are finding out that now here you are getting action potential with a lesser duration of the double the Rieu's voltage. So this duration which is required for double the Rieu's voltage to produce an action potential, this is known as the Chronaxy. So what do you mean by Chronaxy? It is again the minimum duration which is required for double the Rieu's voltage to produce one action potential. Getting my point? So Chronaxy is simple. It is the definition is similar to the utilization time. Minimum duration which is required for double the Rieu's voltage. To produce one action potential is known as Chronaxy of the tissue. Right? So 3 parameters, one is Rieu's, one is utilization time, one is Chronaxy. With the help of these 3 parameters, we can assess the excitability of the tissue. What do you mean by that? Suppose I have given you 3 tissues. One is neuron, one is skeletal muscle, one is myocardium. You have to tell me which tissue is most excitable among them. Neuron, skeletal muscle and myocardium. What do you think? What you are going to do? Okay, what is your answer? Whatever is the answer, what you are going to do? You have to check the Chronaxy of this tissue. Okay, you have to check the utilization time of this tissue. You have to check the Rieu's time of this tissue. List the Chronaxy, list the utilization time, list the Rieu's. More is the sensitive excitability of the tissue. I'm sorry. So list the Chronaxy, excitability is the most. That means to check the excitability of the tissue, you have to check these 3 parameters. So based on these 3 parameters, you can judge the excitability of the tissue. That's why if I say the most excitable tissue in our body, you know what? Most excitable tissue in our body is neuron, right? Followed by skeletal muscles, right? Followed by skeletal muscle, followed by myocardium, okay? Myocardium, and followed by smooth muscle, okay? Smooth muscle. So the neuron is the most excitable tissue, and which type of nerve fiber? Just now we have discussed. A fiber is the most excitable, followed by B fiber, followed by C fiber. So because this neuron is the most excitable tissue in our body, this tissue will have the least Chronaxy, okay? Least utilization time, least Rieu's. But if I ask you, among these 3 parameters, Chronaxy, Rieu's, utilization time, which one is the most important parameter? Your answer is Chronaxy. That's why I am writing Chronaxy at the beginning, because if I have to check only one parameter, then Chronaxy you check and list the Chronaxy. Most is the excitability of that tissue, right? So this is the utilization of these 3 parameters. Now, sometimes this 3 parameter is plotted on a graphical representation. So that graph on which this Chronaxi-Rho-base utilization time is plotted, that graph is known as strength duration curve. This is known as strength duration curve. Again, image based question can be given from this topic, strength duration curve, right? So okay, so we are going to plot this strength duration curve. So x-axis is the time means this is the duration of the stimulus, and y-axis is the strength, that is the voltage of the stimulus, voltage, that is the strength of the stimulus. That's why this curve is known as the strength duration curve. The strength of the stimulus and the duration of the stimulus you are plotting in these two axes. Okay. Now, if you plot one strength duration curve from a neuron, suppose I have plotted one curve from a neuron. So the curve will look like this. The curve will look like this. Okay. So the curve is looking like this. So suppose this curve I have plotted from a neuron. Right. What is the meaning of this curve? Meaning of this curve is that if you take any point on this curve, suppose I have taken one point on this curve, if I drop on perpendicular on y-axis and if I drop on perpendicular on x-axis, suppose this point is the x1 and this point is the y1, I can understand that x1 is the duration of the stimulus and y1 is the amplitude of the stimulus. If you give a stimulus which is y1 amplitude and x1 duration, this stimulus is capable of generating action potential on this neuron. Am I clear or not? So if I take any point on this curve, if I take any point on this strength duration curve, and if I find out what is the strength and what is the duration of that point, then I can conclude that this much strength and this much duration is capable of producing an action potential on this tissue. That is the meaning of this curve. Okay, so strength duration curve means you are plotting the different stimulus parameter and all these stimulus parameter are capable of generating one action potential to the tissue. Getting my point? So now let's discuss from this curve. If I have to find out the Rho base, suppose this is the curve, I'm just swapping out the normal thing what we have drawn already. Okay, so now okay, I have to find out, okay, I have to find out from this curve that what is the Rho base. So what is the meaning of Rho base? Rho base means minimum voltage of the stimulus. So I have to find out what is the lowermost point on this axis, on this x-axis. What is the lowermost point? So if you find out here, you are finding out that this strength duration curve is becoming parallel to the x-axis. So if you take any point on this parallel part, okay, if you take any point on this parallel part and if you extend this on this y-axis, means you are dropping a perpendicular on this y-axis, then the voltage which you are getting on this y-axis, this is known as the Rho base voltage. Getting my point? So what you have to find out? You have to find out the lowermost point which is parallel to the x-axis. That is the minimum point. And from there, if you drop a perpendicular on y-axis, then this y-axis is the voltage, then this minimum voltage will be known as the Rho base. So this is my Rho base. Now, what is the utilization time? I have to calculate the time. So if this is the point, from there I am going to drop on perpendicular on this x-axis. So if I measure this duration, this will be known as the utilization time. Getting my point? This will be known as the utilization time because that is the minimum time duration of Rho base voltage. Now how to find out Chronaxi? Just make the double Rho base voltage. So this is the Rho base. If I make a double of this Rho base, so suppose this is the double Rho base, this is another Rho base, so this point is the double Rho base point. What I am going to do? I am going to drop on perpendicular from here on this curve and from there I am going to drop another perpendicular on x-axis, and if I measure the time duration between these two, then this is nothing but my chronax c. So that way this duration, okay, which duration? This duration if I measure, then that is the chronax c duration. Getting my point? So this way, if the image based question is given, okay, image based question is given, you can easily plot the Rio base, utilization time and chronax c. Now on the same axis, if I plot a curve from a skeletal muscle, so that curve will be located on this side or on left side of this neuronal curve. What do you think? If I plot a curve from a skeletal muscle tissue, that curve will be located on the right hand side of this neuronal curve or on the left hand side of this neuronal curve. Very simple. Skeletal muscle is less excitable than neuron, means the chronax c will be more than neuron, the Rio base will be more than neuron. So easily I can conclude that the curve will be parallel to this, but it will be shifted on the left side. This is the curve of skeletal muscle. Similarly, the myocardium curve will look like this, okay, and the smooth muscle curve will also look like this. So this is shifting of the curve towards the left and upward direction. Okay, so lower the excitability, more is the shifting towards right and upward. So this is not left shift, sorry, this is the rightward shift of the curve, right? So this way you can conclude that lesser the excitability, more is the shifting of the curve towards right side and in upward direction. Okay. You know, this chronax c, Rio base, utilization time, they are also measured in clinical setup also. You know, suppose one patient has presented with a nerve injury, okay, and nerve injury is there, and you have repaired the nerve injury, and during repair you have measured the chronax c and Rio base of this neuron. Then during follow-up, suppose after 1 month, during follow-up, you are again measuring the chronax c, and chronax c is decreasing. So what will you infer from this finding? Chronax c is decreasing. So what is happening? The nerve regeneration is happening or not? So chronax c is decreasing means the tissue is becoming more excitable, means regeneration of the nerve fiber is occurring. But during follow-up, if you are finding out that chronax c is not decreasing but chronax c is increasing, okay, Rio base is increasing, means tissue is getting lesser and lesser excitable, means regeneration is not happening. That way, this property can be utilized for clinical medicine also. Okay, generally the PMR department, they uses this kind of technique, right? Okay, so this is all about your chronax c, Rio base and utilization time, and I will finish up this chapter with a MCQ which is similar to this stimulus parameter. Okay, so look at this. Equal strength stimulus is given to a tissue. Which type is most likely to produce nerve stimulation? So first you try to understand this diagram. So these are the stimulus parameter. I told you what do you mean by stimulus parameter? Means it will have an amplitude. So this is the amplitude of the stimulus and this is the duration of this stimulus. Similarly, in the second cases also, this is the amplitude and this is the duration. So if you look at this diagram, in case of every stimulus, the amplitude is same. Getting my point what I am saying? In all of this A, B, C, D, if you look at the option, the amplitude is same. Here, suppose this is 5 millivolt. Okay, it is also same here. This is 5 millivolt. In this cases C also, the amplitude is same. Here also, the amplitude is same. But what is the difference? Duration is also same. But difference is that in the first cases, that is A, the stimulus is rapidly rising to the upward direction. In B, the stimulus is slowly rising to the upward direction. And in stimulus C, suddenly it is rising upward, then suddenly decreasing also. And in stimulus D, it is gradually riding in the upward direction and then decreasing. That is the meaning of this different stimulus parameter. So, which type of stimulus will produce an action potential easily? Okay. Answer to this question is stimulus A. This is the best type of stimulus. But question is, Why? So, if I give a stimulus like this, which is a rapidly rising stimulus, I have to think of that what is happening on the surface of this neuron. So suppose this is neuron, I have to think of what is happening on the surface of this neuron. If your stimulus is rapidly rising stimulus, okay, there will be depolarization of this membrane rapidly, and that depolarization will open up two voltage gated channel. One is voltage gated sodium channel, it will also open up voltage gated potassium channel. But this voltage gated sodium channel is very fast and voltage gated potassium channel is very slow. So whenever you are giving rapidly rising stimulus, both the channel will open up. Both the channel will start opening up simultaneously, but because of the fast sodium channel and because of the slowness of the potassium channel, sodium channel opening will be very greater than potassium channel opening. And whenever the net sodium is very huge than that of the potassium, the action potential will be generated. Getting my point? Okay. So whenever you are giving rapidly rising stimulus, sodium channel opening number is very higher than potassium channel opening number. And that's why the net voltage inside the cell is very high, that is producing action potential. Now you got the gist. Now, if you give a slow rising stimulus, so this is my stimulus, this is a slow rising stimulus. If you give a slow rising stimulus, then the sodium channel opening will also be slower in nature. So the sodium channel opening will also be slower in nature, and potassium channel itself, it is a slow channel. So slow opening of the sodium channel will occur. Why? Because your stimulus is rising slowly. You are giving slowly stimulus. So what I am finding out here, the sodium channel is also opening up, and proportionally potassium channel are also opening up, and both of them are opening up in the same manner. So this inward positive charge of sodium will be neutralized by outward positive charge of potassium. That's why in this slowly rising stimulus, action potential may not be produced. Action potential may not be produced in these cases. This kind of property, where you give slowly rising stimulus and neuron is not producing action potential because you are not able to reaching to the threshold voltage. Getting my point? If the sodium and potassium both are opening proportionally, then your depolarization will not be sufficient enough to reach to the threshold voltage of the membrane, and you are not going to get an action potential. This property of neuron is known as accommodation property. This is known as accommodation property of neuronal membrane. Means if you give slowly rising stimulus, the channels on the membrane, they will also accommodate accordingly, and because of this accommodation, the action potential is not going to happen. So in this question, okay, I can easily understand that the base stimulus is the first one, okay, and this B type of stimulus, that is the most slowly rising stimulus. So this is the least effective stimulus. This is the least effective stimulus. Okay, this C will be also effective. So this A greater than C greater than D greater than B. This is the sequence of stimulus which are capable of generating action potential. A is the best and B is the least effective stimulus. So this is all about your nerve fiber classification, stimulus parameter and associated discussion.